I'm always being asked what the best way is to track the success or failure of a marketing campaign. And the best thing that we can do, in my recommendation, is to use a HIPAA-compliant call tracking campaign. In our case, we're using CallRail. I've removed the company name, the patient's name, and the phone number to protect the HIPAA requirements. But understand, here's what we have here. These are all first-time calls from organic. And you've got Google Organic, Bing Organic. And now what we have that we never had before is now we can say we had 15 answered organic calls from Google in January, 13 from February, and so on and so forth. And then you can go in as the practice manager, go into your practice management system. Yes or no, are they a new patient? Yes or no? And then from here, you can, if you want to later on, you can add the value of the treatment. But at least in this case, you'll know. Let's say we have yes, 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 yes. So you know you had 4 new patients here. And you know, let's say yes, yes, yes. Is that 5? It doesn't matter. You'll know that you had in April 11 phone calls from organic traffic, and 4 of them became new patients. And you know, here you had 13, and 5 of them became new patients. So now you know that you spent whatever you spent on SEO or whatever marketing services. Here would be organic SEO because it's organic. And whatever you spent on marketing here on organic traffic, you had 11 people come to the site, and 4 of them became a new patient. Sorry, 11 call. 13 of them called, and here we have 5 of them became a new patient. And you know the names. So this is how you go from website interaction to actually understanding someone who actually booked an appointment. And for the bonus plan, you go in here and you add, whatever, for example, whatever happened to be worth for the patient. So now you actually know how much revenue you're generating. But at this level, the only thing that matters is you had 4 new patients this month from organic traffic. Here you had 5 from organic traffic. They came off 11 phone calls or 13 phone calls. This is how you establish a baseline. So we know for this practice, right now, 15, 13, 13, 11 is the number of phone calls they're receiving from organic traffic that are potentially new patients. Now, of course, and over here with our tags, we can actually see what's booked, what's not booked, and you can take that a step further. But for now, if you want to know, how am I supposed to figure out if my marketing is working or not working, this is your first step.